Hello and welcome. Today we are going to talk a little bit about split hand-foot malformation. Split hand-foot malformation is a limb abnormality that is present at birth. It can be inherited as a single abnormality or as part of a syndrome that includes other characteristics. As stated in the previous slide, split hand-foot malformation is a congenital malformation that is caused by a genetic mutation due to either deletion or transformation of genes. Because of the way it looks with the absence of the middle finger and fusing of the other fingers with a cleft in the middle, it is often referred to as lobster claw syndrome. Some patients only suffer from the malformation, while others have other symptoms including deafness, absence of an iris, or even complete absence of the hand, in addition to the claw. The first documentation that I can find was with William Stiles, who was born in 1805. This was a common affliction in his family, and numerous members traveled with the carnival as a sideshow attraction. William's son Grady, who was known as the Lobster Boy, was one of his children that traveled with him. Grady was known for his violence and strength, as well as the murder of his daughter's soon-to-be husband the night before their wedding. However, most individuals who live with this affliction are of normal intelligence and live a normal lifespan. Another name this is referred to is extradactyly, which is the absence of the third metacarpal and digit, which results in what is called the cleft, and syndactyly, which is the fusion of two or more digits. There are varying degrees and types of split hand-foot malformation. It can affect one hand, one foot, both hands, and or both feet. Every patient is different. This is a before and after of a little boy who suffers from split hand-foot malformation. It is remarkable when you look at the difference and the fact that he can now hold a pencil and write. That would have been very difficult before the surgery. The after photos are 1 year post-op. This is an amazing transformation. As you can see, the two bony pieces, indicated by the arrows, were removed to close the cleft. Z-shaped incisions were made to release the fused fingers, the syndactyly. Post-operative mobilization and strengthening exercises were done as part of his rehab process. Actress Bree Walker has extradactyly. She played a character on Nip Tuck who was asked if she had children and if they inherited the condition. I think her character's response is very fitting. Tossed the coin and it came up tails both times. They both have it. Ultimately, I decided they had every right to be here and to be different.